Welcome to my podcast. Today I'm going to talk about another common case here in the UK, and basically it's as a guideline for primary healthcare setting. And it's concern women with certain issue, which is called under the umbrella and gynecological cancers. So the aim of this podcast is basically to raise awareness and understanding of the suspected cancer and to increase confidence in recognizing signs and symptoms and how to manage them with referring and safety netting whenever you encounter such condition in the primary healthcare, which is basically the GP setting and the community setting. With the emphasis of vigilance to the lower GIT condition when the patient presents with non-specific symptoms. The most commonly 5 gynecological cancer listed in the UK in order of their occurrence is uterine, ovarian, cervical, and vulval and vaginal cancer, with highest mortality rate basically for the ovarian cancer, whereby 4,100 deaths occurred in 2018 until 2021 in sequence. And uterine cancer took the fourth most commonest diagnosed cancer in women, and the UK shown about 9,800 new cases annually diagnosed, which makes like 27 diagnosed every day, which is really high. This is to the cancer research statistic of the UK, with more than 9 in 10, which is basically 93% in female aged 50 or more. And it has increased by around 58% since 1990. And when diagnosed earlier, it shows that 9 in 10, which is around 92%, will survive their disease for the first 5 years, compared to half, which is around 49% on those who are diagnosed later stage, like stage 3. So this takes us to ovarian cancer. There are around 7,500 new cases of ovarian cancer in the UK every year, which equate to around 21 women diagnosed each day. And it's the 6th common cancer diagnosed in the UK after breast and lung, bowel, uterine, and malignant melanoma. So that's the ranking. And the 5-year survival is largely dependent, of course, on the stage of the ovarian cancer being diagnosed, with 60% diagnosed at later stage, which is really high, and this was in 2018. So doctors need to use their clinical concern and intuition to diagnose those kind of cases, and not to hesitate to refer them if red flags shown, or you have certain intuition that there is something doesn't seem right. The patient, of course, have their own concern. And 11% of the ovarian cancer are preventable, with one of the main risks being, for those kind of cases, risk factor are obesity, smoking, nulliparity, if she's taking HRT, especially if it's for a prolonged period of time, as well, of course, the genetic risk if it's running in the family. And it shows that combined oral contraceptive pills reduce the risk, so it's like protective. And of course, we know that one of the measurements we can do in ovarian cancer, once we are suspecting that, it's C125. However, if it's normal and the patient could not be or has been excluded, you need to think about other condition which could be raised in, like lung and pancreas cancer. Most of the cases usually they will present with non-specific symptom. I recall years back, once I was freshly graduated, a colleague sadly She passed away because she was diagnosed late by ovarian cancer, and it's really tragic. So once C125 is negative, it doesn't exclude anything. You need to do further investigation in order to make sure that there is nothing to be missed. Most of the cases could present with non-specific symptoms like bloating, abdominal distension, alternation in the bowel habit. There could be history of weight loss, or feeling full, loss of appetite, and urgency for urine. So, for instance, there's a case study which showed that a woman, she wanted to lose some weight, and she was like with her partner. She was like reading about healthy lifestyle, so she was following that with her partner, and she managed to lose like 1 stone. And she thought in her mind that that loss is basically because of the healthy lifestyle, but she had some symptoms like bloating, abdominal distension, and she had like bloating, and I think there were like bowel habit changes. I'm not quite sure. Just a case I studied and read about. However, she managed to lose her weight, and when she called her GP with those kind of symptoms, the bloating and abdominal distension and the urgency for the urine, I think the bowel habit wasn't changed. I just remembered now. So the GP was a little bit suspicious and asked her some questions, and she said that her partner didn't manage to lose any weight, though they are doing the same thing. And I'm sending her for urgent, this one, the 2-week referral. Turned out that she has ovarian cancer, and the case has been taken from that in that regard. For the cervical cancer, it's the fourth common cancer for women worldwide, and around 19% in the ranking in the UK, mostly in the age group of 30 to 34. And 99.8% cervical cancer were caused by human papillomavirus, according to Brown, 2018. And of course, we know about the human papillomavirus vaccine, which has been introduced early on in 2008 for the age group 11 to 13, which were offered voluntarily. And it has been by then modified and called under different names like Gardasil. And it's mostly to protect against the cancerous type. However, nowadays it covers many variant strains of human papillomavirus. And it also protects against an anus, penis, vulva, mouth, and throat cancer. And in 2012, it has been added some for covering for other strains of the human papillomavirus. And it's been offered as well for gays, bisexual men of the age group of 45 years. And thus it has evolved across the time since it has been started and proven to offer protection. And so from that regard, it's important to emphasize or exercise your clinical intuition when you're working in the primary care setting. And if you encounter a case as such, you need to take it seriously and investigate further in order to save lives, to diagnose early on, and to be treated and increase the survival rate. Thank you.